Hi everyone, I'm Szenan-Balance. Welcome to my blog. In this blog, I'm gonna introduce a case about WuYunLiuQi. And WuYunLiuQi is very few people talk about it. I haven't discovered anyone in English world that talk about WuYunLiuQi. Maybe there's some. If you know anybody talk about WuYunLiuQi, please comment down there and let me know. And I've seen some of Chinese practitioners talk about WuYunLiuQi, but it's too complicated. And my way of doing WuYunLiuQi for my patient is very simple. Here's a case that I treat a patient using internet consultation, which I don't see the patient directly. Then I just get the birthday and work out what WuYunLiuQi on her birthday and work out the right now, today, the WuYunLiuQi of today, and get 10 of the factor and put it all together and do a analysis. Then bang, I've got the diagnosis, and I just prescribe the herbs and send the herbs over to my patient. She took it for 1.5 days to 2 days. Then she got much better. Let's have a look on this case. Now, this is an internet consultation. This is a female patient, 1976, born in 1976, and December 28th. That she complained about sore throat. She sent it over to me. Let's have a look. Sore throat. What would you think about sore throat? Normally we would think, wow, it's a heat sensation, isn't it? It's a heat condition. And tired, a little bit weak feeling in body. A bit of nausea, bowel motion are getting back to normal after a bit of diarrhea and vomiting on Wednesday. So diarrhea and vomiting, it can be cold condition, it can be heat condition as well, right? So we're not quite sure which one is that. From here, we can't tell. I don't feel feverish today, which means she was feeling feverish, which means she may get fever before today, right? So and I have my appetite almost back to normal. Normally, if you got no appetite, that is a cold symptom, which means that's getting better. That's a good sign. I have a bit of infection in my gums, just sore and swollen around wisdom tooth. Well, we know that most of the time for gums infection, that is, and according to Chinese medicine, that is a heat condition. A little dry cough. Wow, that is huge. What is that? Because a bit fever, dry cough, diarrhea. What does it look like? It may be COVID-19. We don't know. Well, I don't want to say this is COVID-19 because I really don't know. But I think she didn't go to the hospital and check it out, so we don't know. But dry cough is a heat condition as well, right? It's dry, it's not wet. Not 100% sure what's happening with that yet. So that's it. I didn't ask further question. I didn't get any further information. I think, well, that's good because I don't actually need the other question to find out some more answer, more information for my diagnosis, okay? Because the only thing that I need is the birth date, right? Here you go. Let's have a look. I got two websites over here. I'm not quite sure whether there's English website to find out WuYunLiuQi, and you really need to know how to calculate it, and that is a bit complicated. I'm not gonna go through that. If you're interested in the future, I'll give you a class about how to find out the WuYunLiuQi. Of course, this is a paid class, paid workshop. And let's get whether you're interested in WuYunLiuQi or not first. Now, let's have a look at this one. So I figured it out on the website from here, which is just take what? Within 30 seconds, I got all the results in here. I just put all the birthday in, and bang, it come out with this. It's in Chinese, but I translate it in English right now over here. The first thing we're gonna do is 煮 晕. 主晕 it's called cold water excess. 寒水太过. That's water and cold water excess. Too strong, right? Then 失天 and 在权, there is a pair up 失天 and 在权 that we put in here and here. 失天 is 太阳 cold water. 在权 is 太阴 damp earth. Then we got 主气 and 客气. Then 主气 is 太阳 cold water. 客气 is 太阴 damp earth. What does it mean over here? It's the constitution of the patient when she born on that year, December, and the date. That has been decided ever since she was born. Right? That's so simple. Now, let's have a look over here. And that is between April 30th to May 21st, right? And May 21st, and today's date is actually 3rd of May, and she came to me on, I forgot to put it in here, I should say it over here, say first visit. Oh, that's not right. It was on the 1st of May 2020. So it actually fit in between 30th of April and 21st of May, right? So I run another check on the website, and again, within 30 seconds, I got the answer. I screenshot and put it over here, and so everyone can see it. Unfortunately, it's in Chinese again. Now, don't worry about it. I'll translate it for you. 主韵, and between this to this day, 主韵 is metal excess. So metal is dry metal excess. Then it comes to 失天少阴君 fire. 在权阳明 dry metal. 主气少阴君 fire. 客气厥阴 wind fire. Okay, now you're probably very confused. What are these all talking about? This is about the date today, and in this time frame, the WuYunLiuQi of this time frame. This is the WuYunLiuQi of the birthday. Alright, so we have 1, 2, 3, 4, 5. 5 factor. Forget about 太阴, 太阳, all about here. Just focus on water excess, then earth, right? And water excess means cold water excess, right? Too much. Fire, 君, which means is, there is another 相, we're not discussing here. 君 fire, fire was hot. 少阴 is hot. Then metal excess, metal is dry metal. And wind wood, dry metal. So there's another 5 factor. We're gonna take 10 factor and put it over here and get an analysis. Let's just follow me and I will guide you step by step. So let's put all the 10 factor over here. Wind wood. How many wind wood do we have over here on those 10? There's only 1 over here. So 1 over here, which those are going to cause this problem for this patient, right? So one wind wood. Sorry, over here, English. 1 wind wood. Then how many June fire? Let's go through it over here. Just do a calculation and work it out. 1, 2 June fire. How many damp earth? Sorry, this should be earth, not water. Let me change it. Earth. Let's go through it. 1, 2, damp earth. Then how many dry metal? Let's go through it. Dry metal. Anything in here? Nothing in here. That's 1 dry metal. Metal SS means dry metal as well. And dry metal. Dry metal over here. 2 of them. How many cold water? Cold water. 1, 2. That's 2 cold water. And water SS means 3. And none of them over here. So let's work it out. Is it 10 added up together? 3 plus 2, 5 plus 2, 7 plus 2, 9 plus 1, 10. Yes, all 10 factor of WuYunLiuQi over here. Now we're going to make a diagnose. How do you make a diagnose? Okay, the diagnose 1 cold water, 1 wind wood. They are 2 strong and 1 cold water and 1 wind wood. And do you know how to get to here? Okay, let me show you. This is very interesting and it's so easy. Okay, that's good. Damp and dry. 2 damp, 2 dry equal nothing, right? Equal 0. So they both both balance each other. Or damp and dry balance each other. This is my thinking. Now, how about cold and fire? Now, I have 3 cold water in here. Just fire and cold, they're both against each other, right? So 3 less 2, that's just 1 cold water. Here you go, that's 1 cold water. Now, how many wind wood? Just 1. Wind wood not going to do with any of them. So, cold water and wind wood. So, which means is assess in this condition, our diagnosis, this patient has cold water, too much cold water, 1 of them, and too much wind wood. So what in the okay, let's talk about the formula. The principle of the principle is sorry, I forgot about here. I should put it in here. The principle is the treatment principle is actually we're gonna reduce water and reduce wood, right? Those are principle of treatment because we know that 2 of them is too strong, or those 2 factor. Then we got formula over here. So what is the formula? Let me get you to the next page. So that's the diagnose, 1 cold water, 1 wind wood. And the treatment principle, reduce water, reduce wood. And tonicify earth. Why tonicify earth? Alright, and here I'm going to do a bit of explanation to you. And it totally makes sense for you. Alright, it definitely makes sense. When I do this, you will get the idea why I call it water excess or water too strong iron triangle. Why do I do this? Okay, here you go. Now, with water, we want to reduce it and we want to reduce wood as well. What is the relationship between water and wood? Okay, water support wood, right? Water support wood. And wood is the son of water. And now here is a principle of 5 elements when it comes to treatment principle. There are 2 principles. One is for the diagnosis of deficiency. One is for the diagnosis of excess. Now, for the excess, we call we said that reduce the sun for excess symptom in the 5 elements, right? Then for the deficiency, we call tonified the mother for deficient conditions, right? So now we know the treatment principle. Now, in this case, that water over here and wood, both of them are strong, right? And what do? We want both of them reduce, become weaker, right? So we're gonna reduce the kidney, right? So when we reduce kidney, the kidney become weaker. But can we reduce the kidney even better? Yes. How do we do that? Follow the principle of reduce sun when it comes to excess conditions, right? So wood is the son of water. So if we reduce the sun, reduce wood, then the wood will get weaker. Then the water will get even weaker. Does it make sense to you? Alright? So I'm hoping that you're following my thinking over here. Right? So this is important. I would suggest you get a pen, get a paper, and draw it down so you know what's going on over here. Right? Now we know we reduce water, we reduce wood, and both of them get weaker. And if we reduce wood and the water get even weaker, right? Alright, over here. Now we're gonna explain the other theory. The other theory of why I say I call this as an iron triangle. You know? Iron triangle is the best way to reduce. You make sure that the water and wood is gonna become even weaker, right? Even weaker. How do we do that? Right. Here's my thinking. I hope you follow. Get a pen, get a paper, and write down. Now, think about it. I'm saying in here, I'm gonna tonicify earth. Why tonicify earth? No, my purpose is when I tonicify earth, the water and wood become even weaker. Let me tell you this. Earth against water, right? In 5 elements theory. When earth stronger, then the water get weaker. Now I'm tonify earth now, and the water become even weaker, right? So that's good. This move is even better. We're gonna make the water even lower, even weaker, right? Now, what about if what does it to do with wood? Let's have a look. Now, I am the wood actually against earth, right? When wood become stronger and the earth gonna be weaker. What about we do opposite? What are we doing right now? We actually tonify the earth. When I tonify earth, what happened to wood? The wood will come down. The wood will become weaker. This is wood. Wood become weaker. So, with adding one more move, which is tonify earth, the water and the wood will become even weak. It will become even weaker. Does it make sense to you? So, it actually helps the water and the wood become even weaker. This is what we want, right? This is our purpose. That is why reduce water, reduce wood, and tonify earth and become a triangle. And I call this is an iron triangle, which means it's very stable and it's gonna work no matter what. Does it make sense to you? Now, if you think this doesn't work, this theory doesn't work, please let me know down there. Now, if you think this is a good idea, here, give me a thumbs up. What if I do acupuncture for this case? You know, so my treatment, you know, acupuncture and Chinese herbs, okay, both come with what? The same principle. Then in this case, we actually reduce the water and reduce the wood. And what is water and wood? Actually, we're going to reduce kidney and bladder, and reduce the wood, reduce the liver and gallbladder, right? And tonify earth, which is tonify spleen and stomach, right? So, which means this principle, based on this principle, and I do the herbs, and I do the acupuncture. Same theory, same theory. Think about it. How many people can do, and how many practitioners are you even doing this? Your acupuncture and your herbs are actually following your principle, or you just needle your patient with one theory according to meridian diagnose and prescribe the herbs and according to 脏腑辩证, are very different, right? And more people doing differently. Like I used to do 经方, classic formula from Sang Han Lun. So I prescribe the herbs, but when I needle it, I needle differently. I do the needle according to balance method acupuncture. And when you put needle according to balance method acupuncture for the image, there is no formula to suit with the acupuncture. But with this method I show you, there is no confusion, There's no confusion. You use the same principle, treatment principle for herbs, formula, and acupuncture. So where is the treatment principle come from? From the diagnose. So how many people of you that get the diagnose differently? Like when you do needles, you use this different diagnose. When you use herbs, you use other diagnose. It comes from one from 脏腑, one from a meridian 辩证. You know what I mean here? So it's so confusing, You confuse yourself and you confuse your patient. So when it works, you're not sure which work. When it doesn't work, you're not sure which one doesn't work. So that was my issue, to be honest. That was my biggest issue in my practice for many years. Not until I found my master, Xiao Chuan Pan, and he showed me how to take the post, prescribe herbs, and do acupuncture in the same way. Okay, I'm sorry, I haven't got the acupuncture point for you, but you can follow the principle that get to the point. It's simple. So I will let you know right now. Reduce water, which means you're gonna reduce the sun point. Use Wusu point, the sun point of kidney meridian, and the sun point of bladder meridian. Reduce wood. You're gonna use the sun point of liver meridian and the sun point of gallbladder meridian. And tonify earth. You're gonna tonify the mother point of spleen meridian and the mother point of stomach meridian. That's it. Just simply put needle in and it worked for the patient. Look, this is the way that I treat patient. Doing acupuncture, same strategy. Doing herbs, same strategy. Right? Alright, stay awesome. If you like this video, please subscribe to my YouTube channel by checking on your YouTube. Look at here, subscribe button, and ring the bell beside it. And therefore, you won't miss any of my vlog video in the future. Stay awesome, and I love you all. Bye bye.